so we already standard anatomical position. Moving towards the different location of the body. Well, they can be best described with the help of relative terms. Let us learn the basic terms simultaneously with the examples. Here we have a human body. The anterior or ventral is defined as the front surface of the body, as you can see in the given diagram. The term ventral means towards the belly. This term is often used for the trunk region. Then we have the posterior or dorsal surface, meaning the back surface of the body as given. These two terms are extensively used in medical field. Now we will study some other common terminologies. You can see the visual of human body. Now, to learn these terms, we will first learn what is a midline in a body. Basically, it is an imagery line that cuts the body into right and left halves. The medial term highlighted refers to the structures that are confined in the midline of the body or are closer to the midline of the body in its normal position. For example, the inner thighs are closer to the midline of the body. The term opposite to medial is the lateral, which refers to the structures which are present away from the midline or center of the body. For example, the outer thighs are lateral to the body as they are present away from the midline. Moving ahead, we have the term superior refers to the top of the head or the upper side, and it is also known as cranial, meaning towards the head end, and this term is frequently used in describing anatomical structures of body and neck, and simultaneous to it is inferior, which refers to the bottom or the sole of feet. For example, the head is superior to neck. In the descriptions of embryonic and fetal anatomy, the terms cranial, ventral, and dorsal are frequently used. Another simplest example is your lips are superior to your chin, as lips are closer to the head end than chin. From a surgical point of view, we have two commonly used terms. The first one is the superficial, which refers to the structures present near to body surface. The opposite to superficial is profound, which means located deeper in the body or away from the surface of the body. For example, in the model of skin anatomy, we can see that skin is superficial to muscles and muscles are located deeper from the surface of skin. Okay, so let us move ahead. Right here we have two important terms that are only used when describing 2 points on the same limb, which can be either arms or legs. We will discuss them in simplest way. The first term is proximal, which is defined as closer to where arm or leg inserts into the body, which also means towards the origin or point of reference. The other one is distal, which means further away from where arm or leg inserts into the body. To make it simple, as we can see, red arrows indicate the proximal, whereas the green arrows indicate the distal. When we use these terms for the upper extremity, we can say that wrist is distal to the elbow joint, because the wrist is further away from where the arm inserts in the body. When using these terms for the leg, we can say that knee is proximal to the ankle, because it is closer to where the leg inserts in the body. Right here we have the palmar surface pertains to front surface of the hand, where palm is visible. Then we have the plantar surface, pertaining to sole or bottom of the foot. Now talking about more terms. We will talk about some terms of laterality, which means these are the terms who have a suffix lateral, and so we can memorize them easily. It can be illustrated by using this visual, as you can see. The first term is unilateral, as uni means one, so this term refers to the structures present only on one side of the body. The best example is spleen, which is located on left side of body. Then we have the term bilateral. Also, its name indicates these refers to the structures present on both sides of the body. The best example is ears. Another example is lungs, which are located on both sides of body. Okay, so now we will discuss two terms which are a bit complex. We will illustrate them one by one. The first one is ipsilateral. The term ipsi means same. So when referring to body structures as ipsilateral, it simply means the structures present on the same side of the body. For example, the right hand and right foot are ipsilateral. The second one is contralateral. The word contra means opposite. It refers to the structures present on opposite sides of the body. For example, the right foot is contralateral to left foot. Body movement is the fundamental characteristic of life. There are almost more than 600 muscles in the body, and the contraction of these muscles produces body movements. We will discuss each body movement in detail. Movements basically occur on the joints, and each joint performs single or combination of movements. The most commonly used terms of body movement are flexion and extension. Flexion is basically a bending movement in which the angle between the two moving parts decreases, as you can visualize in this image. Then we have extension, which refers to the straightening in which the angle between moving parts increases, as you can visualize in this image. As the name suggests, it is extending. The image basically shows the extension of the leg. Flexion and extension are the movements which occur in upper limbs, lower limbs, neck, hand, and foot. Now we have abduction and adduction, which are the movements of the limbs. Abduction refers to the movements in which the limb is carried away from medial or middle of the body. You can see in this image the adduction of the lower limb. Adduction refers to the movements in which the limb is carried back to the initial position or towards the body. Rotation is a movement of a body part around its axis. We have two terms for rotational movement: medial rotation and lateral rotation. Medial rotation is the body movement in which the limbs rotate medially or inward, and in this visual, shoulder is medially rotated and bent to 90 degrees. The lateral rotation refers to the position which rotates the limb in outward manner or laterally. In this visual, the shoulder is rotated laterally and 90 degrees outward. Supination and pronation are the movements limited to the hand and the arm. Supination occurs when the palm faces forward, as we can see in this visual where the supination occurs, and it is the direction of the hand when we get the soap and also when we turn our hand over to receive the money, and the forearm is rotated to 85 degrees. Pronation is the movement in which the palm faces the floor, so we can say that pronation is the movement of the hand in which the back or dorsum of hand faces the sky and the palm faces the floor and is rotated to 70 degrees, and pronation occurs during many hitting activities such as baseball pitching and football throwing. To distinguish between these two movements, an easy way is that the term supination contains the word up, so we could take it as supination is that movement in which palm is up. All right. Next, we have the terms inversion and eversion that are the movements limited to the foot. Inversion is that movement of the foot in which the sole or foot turns inward. For example, twisting the ankle in is the inversion movement as it is shown in this picture. Eversion is that condition of the foot in which it is rotated outward, and here is the everted movement of the foot. For example, twisting the ankle out is the eversion of foot. Remember that these two movements occur in case of any deformity, such as ankle sprain, which happens when you move, twist, or roll your ankle in an abnormal manner. Protraction and retraction are also basic movements. Protraction is the forward movement as we can see in this picture. Retraction is the backward movement, as we can see that the shoulder girdle is retracted or moving backward. These movements are limited to the lower jaw and shoulder girdle. Here the question arises why these movements do not occur on upper jaws. Because the upper jaws are immovable. Moving ahead, we have two terms called as elevation and depression. Elevation refers to raising of body part, as you can see the raised scapula in this illustration. Depression refers to the lowering of scapula or shoulder girdle, as shown in the picture. These movements are also used for the jaws. The elevation and depression of scapula occurs in the coronal or frontal plane of the body, which divides the body into front and back regions. Circumduction is a combination of all the movements, and to our surprise, circumduction is a combination of flexion, extension, abduction, and adduction. Circumduction of shoulder or hip joints basically forms a cone of movements in which its distal end moves in a circle. Opposition and reposition are the movement limited to thumb and fingers, only occurring at carpometacarpal joint. During opposition, the thumb pad is brought to touch all the finger pads, and during reposition, the thumb and the fingers return to their original anatomical position. A visual illustration is given here, as you can see. The terms specified for movement of foot are dorsiflexion and plantar flexion. Dorsiflexion is the movement in which foot moves upward and the angle between leg and foot decreases, as we can see here. Plantar flexion is the movement in which the foot moves downward and the plantar or sole is flexed. The angle between leg and foot increases, as we can see here. The planes are made, which makes it easier to understand the body structures. We have three major body planes: sagittal plane, coronal or frontal plane, transverse plane. We will study each in detail. The first plane is the sagittal plane, which divides the body into left and right halves. In this visual, the body is divided into equal parts. One is left and the other one is right. Flexion and extension movements usually occur in this plane. The second one is the coronal, also known as frontal plane, and it divides the body into anterior and posterior parts, or the front and back. Here is the example in which the human body is divided into an anterior side and a posterior side. Abduction and adduction movements occur in coronal plane. Making our way towards the end, the last one we have is transverse plane, which divides our body into upper and lower halves, and it is also called as a horizontal plane. Here we have an illustration in which the body is divided into upper and lower part. All rotational movements occur in this plane. So that was all for today. Stay connected for more such anatomy-related medical videos only on sqadia.com.